A powerful weapon. A brief history of chemotherapy. Chemotherapy, the use of drugs to treat cancer, has a surprisingly long history. Its roots can be traced back to the early 20th century. Scientists discovered that mustard gas, a chemical weapon used in World War I, had a peculiar effect on the body. It attacked rapidly dividing cells, including those in the bone marrow responsible for blood cell production. This observation sparked an idea. Could this cell-killing property be harnessed to target cancer cells, which are also known for their rapid growth? Researchers began experimenting with nitrogen mustard, a derivative of mustard gas, and found it to be effective in shrinking tumors. This marked the beginning of chemotherapy as a cancer treatment. The discovery of other chemotherapy drugs followed. Methotrexate, initially developed for rheumatoid arthritis, was found to be effective against leukemia. Over time, scientists developed a whole arsenal of chemotherapy drugs, each with its own mechanism of action and target. Today, chemotherapy is a cornerstone of cancer treatment, used alone or in combination with other therapies like surgery, radiation, and immunotherapy. While it has its limitations and side effects, chemotherapy remains a powerful weapon in the fight against cancer. Cancer is not a single disease but a group of diseases characterized by uncontrolled cell growth. The human body is made up of trillions of cells, each programmed to grow, divide, and die in an orderly fashion. Cancer disrupts this delicate balance. Cancer cells ignore the normal signals that regulate cell growth and division, multiplying uncontrollably and forming tumors. These tumors can invade nearby tissues and spread to other parts of the body through the bloodstream or lymphatic system, a process called metastasis. Chemotherapy aims to disrupt this uncontrolled growth by targeting and killing cancer cells. However, it's not always a precise weapon. Chemotherapy drugs can also harm healthy cells that divide rapidly, leading to side effects. Understanding the nature of cancer and the challenges it presents is crucial for appreciating both the potential and the limitations of chemotherapy. Some drugs prevent the cell from making DNA, while others block the formation of proteins essential for cell division. By targeting rapidly dividing cells, chemotherapy aims to selectively kill cancer cells while sparing most normal cells. However, some healthy cells, such as those in the bone marrow, hair follicles, and digestive tract, also divide rapidly. This is why chemotherapy can cause side effects like low blood cell counts, hair loss, and nausea. Other classes of chemotherapy drugs include mitotic inhibitors, which disrupt cell division by targeting microtubules, and anti-tumor antibiotics, which interfere with DNA function. The choice of chemotherapy drug or combination of drugs depends on factors like the type of cancer, its stage, and the patient's overall health.
Section 5. Disrupting growth. How chemotherapy attacks cancer cells.
Imagine a bustling city with construction sites everywhere. That's a bit like what's happening inside a tumor. Cancer cells are constantly dividing and multiplying, building new structures and expanding their territory.
Chemotherapy drugs act like saboteurs, disrupting the construction process at various points. Some chemotherapy drugs, like alkylating agents, are like demolition crews. They damage the DNA blueprints essential for building new cells, preventing the construction from even starting.
Others, like anti-metabolites, are more like saboteurs who swap out essential building materials with faulty ones. These drugs interfere with DNA and RNA synthesis, disrupting the production of proteins, the building blocks of cells.
The result is a chaotic construction site, with incomplete buildings and faulty materials. Without the ability to build new cells, the tumor's growth is halted, and it may even shrink.
Section 6. Why chemotherapy works, exploiting cancer's weakness.
Chemotherapy's effectiveness lies in its ability to exploit a fundamental weakness of cancer cells, their rapid and uncontrolled growth. Cancer cells are constantly dividing, creating more copies of themselves.
This rapid division makes them particularly vulnerable to chemotherapy drugs, which target cells in the process of dividing. While healthy cells also divide, they do so in a controlled manner and have mechanisms to repair damage.
Cancer cells, on the other hand, often have defects in their DNA repair pathways, making them more susceptible to the DNA-damaging effects of chemotherapy.
Chemotherapy is like a weed killer for the body. Just as weed killer targets rapidly growing weeds while sparing most established plants, chemotherapy aims to eliminate rapidly dividing cancer cells while minimizing harm to healthy cells.
However, this selectivity is not perfect, which is why chemotherapy can have side effects.
Section 7. A balancing act: chemotherapy's effect on healthy cells.
While chemotherapy drugs are designed to target cancer cells, they can also affect healthy cells that divide rapidly. This is why chemotherapy can cause side effects like low blood cell counts, hair loss, and nausea.
The bone marrow, responsible for producing red blood cells, white blood cells, and platelets, is particularly vulnerable to chemotherapy. When chemotherapy drugs damage bone marrow cells, it can lead to a decrease in blood cell counts, resulting in fatigue, increased risk of infections, and easy bruising or bleeding.
Hair follicles are another target of chemotherapy. Since hair follicles contain rapidly dividing cells, chemotherapy can cause hair loss.
The lining of the digestive tract also contains rapidly dividing cells, which is why chemotherapy can cause nausea, vomiting, and diarrhea.
Section 8. Common side effects. Navigating the challenges of treatment. Chemotherapy can cause a range of side effects, some of which can be debilitating. These side effects vary depending on the type and dosage of chemotherapy drugs used, as well as the individual patient's sensitivity.
Some of the most common side effects of chemotherapy include nausea and vomiting. Chemotherapy drugs can irritate the lining of the stomach and intestines, leading to nausea and vomiting. Antiemetic medications can help prevent and control these side effects.
Hair loss is another common side effect. Chemotherapy can damage hair follicles, causing hair loss on the scalp and other parts of the body. Hair loss is usually temporary, and hair often grows back after treatment ends.
Fatigue is also a major issue. Chemotherapy can cause extreme tiredness and weakness. This fatigue can be caused by a combination of factors, including the chemotherapy drugs themselves, anemia, and the body's overall stress response to treatment.
Increased risk of infections is another concern. Chemotherapy can weaken the immune system by suppressing the production of white blood cells, which fight infection. This can make patients more susceptible to infections, even from germs that wouldn't normally cause illness. Section 9. Beyond chemotherapy, advancements in cancer treatment. While chemotherapy remains a cornerstone of cancer treatment, the field of oncology is constantly evolving.
Researchers are developing new cancer treatments and refining existing ones to improve their effectiveness and reduce side effects. Targeted therapy is a newer approach that focuses on blocking specific molecules involved in cancer cell growth and survival. Unlike traditional chemotherapy drugs, which target all rapidly dividing cells, targeted therapies are designed to be more precise, attacking cancer cells while sparing healthy ones.
Immunotherapy is another promising area of cancer treatment. Immunotherapy harnesses the body's own immune system to fight cancer. Immune checkpoint inhibitors, for example, work by releasing the brakes on the immune system, allowing it to recognize and attack cancer cells more effectively. Section 10. Hope and progress. The evolving landscape of cancer care. The landscape of cancer care is constantly evolving, offering new hope and possibilities for patients.
Advances in our understanding of cancer biology, coupled with technological innovations, have led to the development of more effective and less toxic treatments. Targeted therapies and immunotherapies are revolutionizing the way we treat cancer, offering more precise and less damaging alternatives to traditional chemotherapy.
Researchers are also exploring novel drug delivery systems, such as nanoparticles, that can deliver chemotherapy drugs directly to tumor cells, minimizing damage to healthy tissues. With each breakthrough, we move closer to a future where cancer is no longer a death sentence but a manageable chronic disease.
While challenges remain, the progress made in cancer treatment over the past few decades is a testament to the power of scientific inquiry and the unwavering commitment of researchers and clinicians worldwide.
Section 11. Conclusion: chemotherapy's enduring role in the fight against cancer. Chemotherapy, the use of drugs to treat cancer, has come a long way since its humble beginnings.
From its origins in mustard gas to the development of sophisticated targeted therapies, chemotherapy has played a pivotal role in extending and improving the lives of countless cancer patients. While chemotherapy can have significant side effects, it remains a powerful weapon in the fight against cancer.
Chemotherapy drugs work by targeting rapidly dividing cells, disrupting their growth, and ultimately leading to cell death. While this mechanism of action makes chemotherapy effective against cancer cells, It also explains why it can cause side effects in healthy tissues that contain rapidly dividing cells, such as the bone marrow, hair follicles, and digestive tract.
Despite its limitations, chemotherapy remains a cornerstone of cancer treatment. It is often used in combination with other therapies, such as surgery, radiation, and immunotherapy, to achieve the best possible outcomes for patients.
As our understanding of cancer continues to evolve, we can expect to see even more effective and less toxic chemotherapy drugs and treatment strategies emerge, offering new hope to cancer patients and their families.